Dr. Michael Bernstein. I'm the chief of plastic surgery here in the St. Louis VA system. We offer essentially the full spectrum of reconstructive and plastic surgery at the VA. The plastic surgery team here is very well rounded. We offer almost all aspects of plastic surgery, which is a little bit unusual in the VA system. Part of that is because we're the regional hub, but also there's a strong interest here in providing that full spectrum of care. In particular, if I was to pick out areas that we're notable for, Dr. Ida Fox is nationally recognized for nerve surgery in paraplegics and tetraplegics. Dr. Amber Lease is our new hand surgeon who is nationally recognized for hand surgery. In addition, we are the regional spinal cord center, and so we do the largest volume of complex wound care for spinal cord injury patients.
I think a lot of times people get confused about what plastic surgery means and they think it's just cosmetic surgery, but plastic surgeons offer a lot of service, especially for our veterans, and these can include things like reconstruction after skin cancer or after breast cancer. We treat patients with a lot of problems with the hands and upper extremity, including numbness in the hands or weakness in the hands from nerve compression. I see a lot of patients with wrist and hand arthritis, which is really common in our veteran population. And then we even treat patients who've had weight loss after either surgical procedures or medical procedures to help with weight loss, and we help remove some of the extra skin. One of the things that I really like about being at the VA and being a plastic surgeon is that we collaborate with a lot of other specialties. And so a lot of our patients with skin cancer might come to us from the dermatologist. We see patients from the general surgery and bariatric surgery clinics after patients have lost a lot of weight. We see patients from surgical oncology who have breast cancer reconstruction needs or other needs for breast extra tissue removal. And then my practice, particularly in hand and nerve surgery, overlaps with patients who have spinal cord injury or who have other problems in the hand, including things like heart disease, which actually has some connection to problems with the nerves.
You really don't hear about veterans getting plastic surgery. And if you do, it's more for like combat war veterans that, need reconstruction in some way. Not so much, I guess, breast reconstruction or implants. I'm in remission now, so they knew what they were doing and the cancer's all gone. So I trust them implicitly.
GeroFit is different from traditional exercise or physical therapy programs at the VA because with regards to traditional exercise, we enroll veterans who are 65 years and older, and we do follow all of the evidence base for exercise guidelines for older adults. And so that includes all aspects of fitness, including the aerobic, flexibility, strength, as well as balance training. So we do specifically work on balance. As far as difference from traditional physical therapy is GeroFit is a wellness and prevention program. It is not rehabilitation. So ideally we are allowing veterans to continue to have their wellness and their strength so that they're not requiring any rehabilitation or any institutionalization. Veterans are also allowed to participate in GeroFit for their lifetime as long as they're meeting the eligibility criteria. And we do allow spouses or caregivers to participate as long as they have also gotten medical clearance from their personal doctor.
So when we're dealing with our older population, it is difficult for them to navigate the technology, the internet. And so, however, we find that the veteran may have a spouse that is a little bit more tech savvy, or children, grandchildren that is able to help them. We have set separate times aside to do a trial run to help the veteran navigate through the technology in hopes of them being able to participate in the class.
I think GeroFit helped me out a lot. Been with the program for 3 years, and I think it's a good program. It got me exercising, otherwise I would just be sitting in a chair watching TV.
For me, GeroFit has been a miracle. It has helped me reduce medicine, control a lot of illnesses, And, it's an integral part of my whole VA healthcare, because without it, I might not be here. No telling what would happen.
Gerofit is great for me because it holds me accountable to exercise and to work out my upper body and my lower body and get cardio in there, and it's so healthy, and I really, really appreciate it.
We provide full scope comprehensive dental care for eligible veterans. For those who are not eligible, we provide limited scope services that include relief of pain, treatment of infection, and to prepare them for important medical procedures that they're undergoing. We provide our services through a very talented team of general dentists. And in that, they also provide select specialty services such as root canals, dental implant restorations, and any treatment that a veteran needs that we are not able to provide in-house. We refer them through our robust community care referral program, which has a very wide network of VA community providers available.
Oh, we see a wide variety of patients. We see some that are very conscientious about their cleanings, and we see some that are very involved, that they have more complicated cases. So we see all types of veterans, patients here at the VA.
Yes, coming to dental is very important to my health. Proper dental hygiene is important to my cardiac health. I do have cardiac conditions, and it's imperative that I stay on top of my dental hygiene.
We actually have an array of procedures, starting from maintenance, which is our cleaning and regular radiographs. And then for dental work needed, such as fillings, crowns, bridges, dentures, partials. We're looking into developing our implant program right now, so we can place implants here at the VA and not just restore them. The biggest two ways for them to qualify are through either 100% service connection or being unemployable. So that gives them comprehensive dental care. There are some other ways, depending on the percentage of limited motion of the jaw. And then there's temporary care, which relates more if they need a clearance for something like a bisphosphonate medication or cardiac clearance. Then they're eligible for care that helps them get cleared for that particular surgery.